10 tonight. Over the weekend, Southeast Health released a new plan regarding the high number of COVID-19 hospitalizations in its facility. Robert Smith joins us live in studio with the latest information. Robert, good evening.
Good evening, Paige. The hospital has made several in-house changes, and now they are halting visitation in some circumstances, which went into effect today. The motive for the sudden changes is for them to address a 50% increase, which occurred in a week span. Southeast Health Hospital has implemented some changes after seeing a skyrocket of COVID-19 hospitalizations in the first few days of the new year.
Well, as of this morning, we had 113 COVID inpatients admitted to Southeast Health. And of that number, about 43 of them are requiring intensive care. And about 37 of them require ventilators or breathing machines. And that represents an all-time high.
According to Chief Medical Officer George Narby, one of the reasons why the hospital could be seeing alarming numbers is due to social gatherings during the recent holidays. To accommodate the high number of patients, elective procedures have been canceled to rearrange staff and more beds have been added.
But resources are limited. They don't go on forever. And by resources, I mean staff, beds, hospital space, equipment, medications, supplies.
Narby says they are working constantly on getting more resources, but for the time being, everyone should abide by the CDC guidelines to avoid an uptick in cases and hospitalizations.
The first line of defense against this enemy is prevention. And that means that the public, the people out there, are the ones that are really our first line of defense.
The hospital has also adjusted its visitation policy to reduce the risk of COVID-19. However, there are some exceptions for visitors. The hospital mainly wants to ensure safety for its workers.
I think children and people with special needs in those end-of-life situations, there may be others that I can't recall, but there's a few very narrow situations. We really need to protect our staff and limit their chances of getting COVID, getting sick, and being unable to help.
Now, Chief Medical Officer George Narby says they will continue to make changes depending on those numbers, but he wants to remind you that your behavior matters, especially to your family and the community. Mask up, keep your distance, practice good hand hygiene until the vaccine is available to you, which could be months from now. Paige?